Thank you very much, Ken Corla, and thank to you and to all the deputies for their considered questions and comments this evening. It's positive to have such a healthy conversation on this issue, as there are many differing opinions, and we must ensure such a discussion is given the time to happen. I think there was no surprise to learn this week, Ken Corla, that unprecedented was chosen as the word of the year. The start of the new decade has not gotten off to the start any of us expected. 2020 has been a year of heartbreak for each and every one of us in different ways. We've had to deal with the deaths of loved ones and in many cases have been unable to attend their funerals. We've seen the struggles and the anguish as people have lost jobs and seen their businesses close, and in some cases for good. We have dealt with isolation from family, friends and our communities. The simple joys of taking a walk or browsing in a shop can now put our health at risk from this disease. However, as 2021 beckons, perhaps the word of the year next year will be hope. As Minister Donnelly said earlier, subject to approval, the first vaccines could be administered before the end of the year. We know that vaccines will not be a cure for all this disease, but it is a step towards normality. A step towards a time when we might not have to live in fear for what this disease might do to our loved ones, our families and our friends. And I am thankful for the tremendous amount of hard work that has gone into our response to this pandemic. People have made incredible sacrifices to help keep each other safe. We must, however, be honest in how this vaccine will shape our behaviours in 2021. While the rollout ramps up over the next few months of the year, we will need to stick to the public health measures that we all follow now. We will need to keep safe by keeping our contacts low, wash our hands, wear face coverings and maintain social distance. I welcome the announcement this week that the National COVID-19 Vaccination Strategy and Implementation Plan. A lot of hard work has gone into getting this right across government, in my own department, the HSE, and indeed several agencies and experts. The strategy provides us with a clear path that we can follow for safe, effective and efficient vaccination of the population. It allows us to do this while getting the best out of our health service and continuing with service delivery. Vaccines will be administered in a range of settings that are best suited to the needs of the patient and the practical requirements of individual vaccines. Long-term care facilities, large-scale healthcare sites, mass vaccination centres, GP clinics and community pharmacy settings will all be utilised. There will be no charge for the vaccine. Each and every person in Ireland will be entitled to receive it free of charge. The vaccines will be carried out by registered healthcare professionals, all of whom will have received specific training in the administration of COVID-19 vaccinations. The focus initially will be to administer the vaccine to those that need it the most. As the Minister for Disabilities, I know there has been queries about where people with disabilities align in the vaccine allocation sequencing. It is important to note that, as outlined at present, people with disabilities are included in the plan, although not explicitly listed as a defined group. Depending on one's age, whether they're in a long-term care setting or whether they have a medical condition, will be dictated when one is vaccinated. More broadly, though, the implementation plan is a live document that will change and grow. Further subdivision of cohorts outlined will be needed, and the strategy can adapt based on further expert advice and in accordance with the data and the status of evidence and emerges over time. And just like Deputy Cathal Burry had said in his statements, and perhaps the likes of our peacekeeping groups who are actually going abroad. This will all depend on how we move through the phases of our approach and the experiences in Ireland and abroad. The framework takes into account of the current and evolving understanding of distinctive characteristics of COVID-19, its modes of transmission, the groups and individuals most at risk of severe disease or death, and the known characteristics of the candidate vaccines. Scientists and clinicians will continue to play a key role in determining the ongoing evolution of vaccine prioritisation to ensure the optimum approach from a public health perspective. Based on Ireland's experience with COVID-19 so far and the risks that the vulnerable people and those in the frontline roles in the health and social care settings continue to face, it is essential that they be the highest priority for the programme. In the first wave of the pandemic in Ireland, 56% of the deaths were those in nursing homes and long-term care facilities who were older than 65 years of age. They will be prioritised. Healthcare workers have also borne the brunt of COVID-19 infections, and they will be prioritised, as will the people aged 70 and over, as we know that COVID-19 related hospitalisation and deaths rates increase significantly with age. The announcement that the EMA will consider the BioNTech Pfizer vaccine at a meeting scheduled next week brings us closer to a new phase in our response to the pandemic. As part of the European Commission procurement exercise, Ireland has so far opted into 5 advance purchase agreements, or APA, with pharmaceutical companies, with a process in place to opt into a 6th APA. It is likely that early next year we could have a number of vaccines approved for us. We have made a great deal of progress over the last number of months and will continue to follow the medical and public health advice in order to keep each other safe in the new year. We have hope that the rollout of the vaccines will prevent the most severe cases, hospitalisations and deaths associated with disease, and that we will be able to reopen our society and economy once again. Once again, Ceann Comhairle, I would like to thank all the members of the House for the questions and the issues that was raised here this evening, and I hope that answers provided have addressed some of the concerns.